So thank you very much. As Claudia said, I'm Professor Theo Fotis, Professor of Digital Health and Innovation and Senior Researcher at Trustworthy, which is one of the partners of THEMIS 5.0 project, a very exciting and innovative project about human-centered trustworthiness optimization, hybrid decision-making. We're not going to spend a lot on the project itself, but rather focus on the subject of today about accountability in public services. But just to give you an understanding of what THEMIS 5.0 is about an innovative AI-driven conversational agent, which will engage users, humans, in a productive and intelligent dialogue, which it has the capability of driving and executing a continuous trustworthiness improvement cycles. I mean, this is overall, in one sentence, what the THEMIS 5.0 is. But let me start with a question about from a healthcare perspective, which is the use case that I will focus on. Imagine that you are a clinician and you're using an AI system to assess a patient's risk in developing pancreatic cancer, for example, but you're not fully understanding how the risk is calculated from an AI platform. And if we're talking about public healthcare, this is not a technical issue, isn't it? I mean, it is an accountability problem. And it is an accountability problem because if something goes wrong with this health professional, the clinician is still responsible for the decision that he's making. And this is very, very challenging. So, right. So as I said, I will focus then in one key question. So how do we ensure that accountability when we use AI systems is used in public services? And if we pose this question, then we have three challenges that we need to look at. So who trusts the system? Who understands the decision that the system is making and providing, a recommendation? And who at the end takes responsibility of these decisions? So focusing, as I said, on one of the use cases, I mean, the THEMIS 5.0 project has three use cases about port management, journalism, and healthcare. So I'm going to focus on the healthcare, which reflects also our own work as partner in the project. So the healthcare use case is about an AI system that predicts patients' risk of developing pancreatic cancer. And it does that by looking on medical records and continuous monitoring of the data. So at the end, the system provides clinicians with risk levels and recommendations for prevention and treatment of these patients. So effectively, it acts as a decision support tool. So within the THEMIS 5.0 then project, what we do, we explore how we can make this kind of systems more trustworthy from the end user perspective, using what we apply, a human-centered risk-based approach. So looking at what the end users are saying is, and what we observe in practice, is that trust in these systems is still limited. And why it's limited? Because we hear clinicians questioning how accurate the risk assessment is and how it is calculated. From the patient's perspective, we know also from the literature is that they often prefer decisions being made by humans rather than machine, again, because they probably don't trust it. So even when we have AI systems that they are, really performing accurately and well, and they are robust systems, it is not necessarily trusted or accepted by the users. And this, again, as I said, it is a continuous present challenge. And if we look further, reflecting in our use case within the THEMIS AI, this issue becomes more critical when we reach into the point of taking decisions. So, for example, we know that decisions, they must decide whether to accept the AI risk level that it has been calculated by the system. They whether to follow the recommendations. I mean, can I accept the recommendation that the system is doing? And at the end, how to define a treatment or prevention plan based on this recommendation. Again, these are not technical steps, especially in healthcare. They are decisions that have real consequences on patients. Yes, and I'm sure we all agree on that. So looking further in the data that we have collected in the first phase of the evaluation of the different components of this conversational agent, what we found is that trust depends heavily on how the system communicates the risk. And I guess, for all of us working in this sector and for our attendees, it might not come as a surprise, but it is still present and we need to do something about it. So what we see is that the clearer and easier is to understand the explanation of the risk level and the recommended then actions, the more likely is that our clinicians will trust the system that they're working with. So in other words, transparency of the system, as Claudia mentioned earlier, which is a big, big issue. It's not only enough, oh, this is how it works. It must be also usable. So going further in our project and other key insights that we have so far from our use case is that what we see that the clinicians are talking about is that not all risks are equal because we're talking about calculating risk, but what type of risk are we talking about? And especially in the healthcare use case or healthcare in general, we know that different types of errors have different consequences. It's different to diagnose wrong an X-ray, and it's different to have a very limited pathway for a patient. So that means that trust cannot be based only on accuracy alone. It must be based on understanding and impact of how these risks work in the context that we're looking at. So what are we talking about then? It brings us back to the main subject of today's speech about accountability. So what we see and what we propose and what we are working on in our project is that for accountability to work in practice, we need three things. We need users that they understand the AI's outputs. These users must be able to question or challenge decisions. And at the end, these humans have a responsibility that the responsibility must remain. So without this, accountability becomes just theoretical. And if we reflect to the articles that we heard earlier, that relates directly with Article 14, which is about human oversight. So what that shows us then, and that relates directly with our THEMIS 5.0 project, that it's all about human-centered approach. It shows that a human-centered and risk-based approach is essential because it allows us to move from just simply adhering to standard. Oh, yes, the Article 14 says these are the standards, human oversight, ensure that this is happening. What we do with our use cases, we actually enable trust and accountability in a real world use case. So closing, the presentation, what I want to close with is not just a simple thank you, but also pose a question that it can help us all reflect on accountability in public services in relation to AI. So if we expect our professionals in our use case, healthcare or the journalism, as I said, or port management, if we expect all these professionals to rely on AI systems in these public services, how we can ensure that these people will also understand them, challenge them, and remain accountable for their decisions. And this is the challenge that we are addressing through the THEMIS 5.0. And closing, this is our consortium. As I said, a very exciting project with very knowledgeable partners. And with that, I will close my presentation by saying thank you for your attendance.